Right, thank you all so much for coming. Welcome to our session. So, as we've said, we've got about an hour today with you, and it's really good to see. I've seen people's names and agencies popping up. It's really good to see such a range of partners who've come along today. So, we're going to be talking to you about learning from local child safeguarding practice reviews, two that we published at the end of last year, and what this means for you as practitioners in terms of our local neglect approach. So if we just introduce ourselves first. So Jade, do you want to introduce yourself?
Hi everybody, I'm Jade Maynard, the Practice Development Coordinator from the Children's Safeguarding Partnership, and I lead on the priority areas for the partnership, which is neglect and harm outside the home.
Thank you. And I'm Lucy Edwards. I'm the Practice and Quality Review Officer, so I work in the same team as Jade. So part of my role is to coordinate local child safeguarding practice reviews. So today we're going to focus on the learning from two CSPRs that I say we published at the back end of last year. So one of these was our strategic response to tackling neglect, and that was triggered by a child that we will refer to as baby SF, and then also a thematic CSPR around neglect that was linked to a child known as Child SE. So that's kind of the premise of today. I always say this, I'm kind of the warm-up act for Jade in that I'm going to set the scene as to why our neglect approach was looked at and looking at what we needed to do differently. But Jade's telling you all the really important stuff about what that means for us now. What does that mean we need to be doing more of and doing differently to all tackle neglect together here in Sandwell? So, as I said, we're going to be sharing a bit of context. We're going to be sharing what those two CSPRs looked at, and then we're going to be sharing more information about the new neglect approach in Sandwell and what we can do individually as professionals within our own teams, services, agencies, and what we can do as a multi-agency partnership. What do we all need to be doing together? Because ultimately, no one person or one agency is going to effectively safeguard a child. We all need to have a collective responsibility with that. So just as a reminder, I think Leanne said this, but I know people have been joining. This webinar is being recorded today, so if you don't want your face to be on the screen, then that's fine to leave your cameras off. But if possible, leave them on because it's nice to see faces. It is going to be uploaded to our partnership YouTube page as well, so either yourselves can access this and re-listen to it, or other people who weren't able to attend today can log on and use it. And we want people to use it widely in their team meetings, group supervisions, and so on, to really get those conversations about neglect moving forward. As I've said, we're going to be talking about two incidents involving children where sadly both of these children died. You may recognise, as we're talking about some of the things that happened, you may recognise that child, you may know them personally or professionally. So just a bit of a reminder really to practice self-care. We don't want anybody to go away from here feeling, like they're carrying something heavy. So please do seek advice within your own agency, whether it's from, a trusted colleague, your manager. I know some agencies have like an emotional well-being offer as well. You're more than welcome to contact myself and Jade, and Leanne is here as well as our L&D coordinator. If you've got any questions or just want to have a bit of a debrief. But yeah, just a bit of a reminder to look after yourselves. And then at the end of the session as well, we've got a short Mentimeter survey. There's about 3 or 4 questions. So if you can have your mobile phones to hand, if you haven't already got them nearby, we'll be able to talk about how that happens. It'll only take a couple of minutes at the end of the session. So that's just a little bit of housekeeping for us today. You'll see as well that all of your mics are muted apart from us as presenters. So please do use the chat function if you've got any questions, reflections and comments and so on. Okay, so just a little bit of context first and foremost then. Some of you may have been involved in local child safeguarding practice reviews, but just as a bit of a reminder and a bit of information for everybody. We started to do local child safeguarding practice reviews back in 2019, so they replaced the previous version of it, which was serious case reviews. They ultimately do the same job in that they're looking at incidents where children have come to harm or where they've passed away. But we're much more creative in how we do them and they're much more streamlined. You'll see 2 examples today of how we can do things in a more creative manner. But the idea is that they're much more analytical, much more creative, and much more focused on what the learning is and what does that mean people need to be doing differently. So that's the main difference. In order for us to consider undertaking a CSPR, there's two key criteria that have to be met. So firstly, it has to be that the child has sadly died or been seriously injured, and abuse or neglect has to be known or suspected as a feature of that incident. So in the time leading up to that incident where that child was harmed or died, we have to be able to evidence that there's abuse or neglect in the kind of build up to that moment. Um, if that is the case, we then undertake what's called a rapid review. So all agencies are asked to provide their information on their involvement with the families. They're asked to reflect on the good practice within their involvement and within multi-agency involvement. They're asked to identify any areas for improvement, which obviously with hindsight is always much easier than when we're in our, busy day jobs running from pillar to post. And then all of that information is considered at the rapid review by senior leaders from across all the partner agencies, and they make a decision as to whether we do a CSPR or not. So a CSPR is a statutory review. So if we do it, we have to do it within a certain time frame. Once all parallel proceedings are ended, so if there's a criminal investigation or a coroner's investigation, we can't publish it until those are completed. As it says here, we always use pseudonyms to protect identities, but there's always that chance that somebody could recognise that child and know that it's about them. So the last thing we'd want to do is prejudice any other proceedings that are going on. So CSPRs are always multi-agency, so it's always about that. What are we doing as a collective? What do we need to do more of? With hindsight, what could have been done differently, and what do we need to do differently in future to try and reduce the likelihood of a similar set of circumstances for another child and family. It's always about analysing our practice, our processes, our pathways, looking at it with that kind of constructive and critical eye, what works well in this, what do we need to perhaps change and adapt, because things change so often. We have to be really fluid in kind of how we respond and how we work with families, and also anticipating things like COVID, like, pandemic. Who could have foreseen that? We have to be really as I say, fluid in how we're working with children and families. We always try to be as reflective and constructive as possible. We've just been talking about this in a panel meeting this morning, that everybody who works with children and families comes with the intention of doing the very best for that child and family. And often when you look at incidents, it's a series of lots of different things that all kind of come together to create that perfect storm, that, as I say, with hindsight is much easier to kind of look back on and say, yeah, we should have done this, we did that, we need to do more of this, and so on. And where possible, we always get the voices of children and families. So if there's any surviving siblings or, parents, grandparents and so on, they don't have to give their views. It's not, something that's compulsory, but we do always give that option, and we always include the voice of practitioners as well. So that's just a bit of an overview of what a CSPR is and what it does. So these two particular ones that we're going to talk about today were triggered by the sudden deaths of two children. These children both died within a 5-month period. They were completely unrelated incidents, no links between the families whatsoever. But what we had over an 8-month period, we had 3 deaths of children that were linked to where neglect was a significant feature of their lives. 2 of them met the threshold for a statutory review, as we're going to talk about today. But myself and Jade have kind of reflected on this, that when you look across a wider period of time, you can identify numerous children. I think we said up to 7 children where we could say neglect was a significant feature in that child's life in the time leading up to that incident. Just to reassure everybody as well that both children had surviving siblings, but they are being appropriately cared for and supported by their wider families and by a range of professionals as well. I think the challenge as well with neglect, which I know Jade will talk about in more detail later, it's certainly not just an issue for us here in Sandwell. It's definitely something that, is seen up and down the country. And I think people have struggled sometimes to identify it, because neglect is often made up of so many like different little elements that all come together to kind of create that picture. And it's about evidencing that persistence, that's in the definition of what neglect is, and how do we kind of quantify what persistence means. So I think that's something that we know that practitioners sometimes have found challenging to kind of evidence. Okay, so firstly, we have child SE. So this was a child who was of primary school age. They were non-verbal and had autism, so there had been concerns within this child's life. They'd had involvement from specialist inclusion support early years as well. There had been a recent history of statutory involvement with the family. So there were older siblings, and there had been, different touch points within older siblings' lives where there had been kind of similar concerns pertaining to neglect. And within the year before this child died, there had been a period of statutory involvement as well. The child had, sorry, I've got something flying at me. The child had recently been agreed that they could move to a specialist education provision from mainstream. So that was kind of in the process when this child sadly passed away, but they never quite got to that specialist educational provision. As I said previously, we don't usually publish CSPRs while there's an ongoing criminal investigation, but because we did this as a thematic review, if you look in the report on the website, there's very little detail about the particular child and their family. So there wasn't really anything in there that could kind of prejudice a criminal investigation. So it was agreed that we could publish while the criminal investigation was ongoing. And as far as I'm aware to date, it still is an ongoing investigation. So some of the things at the outset that we wanted to look at was we had a neglect strategy in place. We'd got the Graded Care Profile 2, or the GCP2 as our neglect assessment. We'd got things that had been in place for a number of years, but from what we were seeing in these rapid reviews where there were neglect concerns was that how effective is it? How are our practitioners knowing how to use this, where to access it, and how can we support them to make the best use of it, as I say, in people's busy lives. We also wanted to make sure we got clear access to those thresholds, to our neglect pathways, to a range of resources. So not just GCP2, what else are agencies using out there, and are we giving a consistent message about how that should be used to help us understand neglect. As I've alluded to, there was a real kind of discussion around confidence levels and how confident our practitioners are identifying and naming neglect and having those conversations with parents and families, and how effectively they can intervene as an individual agency, but also as a collective, a team around the family or a core group. How confident are practitioners in kind of challenging those concerns and kind of naming them. Also, as I say, we'd got a young person who'd got, additional needs. So how do we support people to make decisions where there's a child who's got a disability or an additional need, and where there are also neglect concerns? Because sometimes there was almost a level of confusion as to, is this attributed to the disability and the additional needs, or is this as a result of neglectful care for this child? So again, that's kind of been a challenge for practitioners. And as I said, when this young person sadly passed away, there was still some elements of kind of COVID restrictions and, the really challenging, unprecedented times that we were all working in just a few years ago. Child SF, as I say, a completely unrelated incident. So this was a very young baby who'd been born prematurely, and had spent the first few weeks of their life in the neonatal unit. And it was shortly after they'd been discharged from hospital into the care of one of the parents that they sadly were found deceased. They'd been subject to a statutory plan that was pre-birth. So yeah, there'd been involvement while mum was pregnant, and concerning older siblings as well. And that was still in place at the time that this child had passed away. So one of the things this review looked at, this happened after the death of child SE. So we'd already got a CSPR that was up and running, that was very much looking at our operational response to neglect. So the majority of serious case reviews and CSPRs look at the front line, what we can do to support and develop frontline practice and systems and so on. But we thought, we need to flip this and look at this from the other side really, and look at our strategic response. So the people in our agencies, our statutory partners who have the most responsibility and accountability for driving forward change and improvement in their agencies, how can we look at that strategic response to tackling neglect, both within their own agency and a collective? So a lot of actions were already identified in this rapid review. And as I say, we'd already got quite a lot that was underway in this thematic CSPR. So it was agreed that we would work on the actions that had already been identified in the rapid review and pull that together as our strategic response to tackling neglect. So it really looked at that leadership and strategic steer. and wanted us to set out that strategic commitment. What are our executive leaders going to be doing differently? What measures of success? How are we going to know whether this is making a difference or not? And that was underpinned as well by a strategic action plan, which is managed by the Tackling Neglect subgroup, which is like Jade's area with the priorities. So we got a clear plan of action that wasn't published, but our overall response really kind of sets out what that commitment is from our strategic leaders. So these are the headlines of what the recommendations were from the thematic CSPR. So looking at our effectiveness of our local neglect strategy as it was at the time. Jade is going to talk through in much more detail about what all of this means as part of the neglect approach. But just to pick kind of a few of those key points, practitioners that were spoken to as part of the review by the independent reviewer said that there was a real appetite for kind of having some easy to digest information, accessible information that they can kind of log on to and kind of pick and choose what would be helpful to them in working with neglect. And similarly as well around having a suite of neglect assessment tools that are suitable to each situation and to try and to unpick what the strengths are and where the concerns might be as well. As I said, we'd already got a neglect strategy in place and some different areas to help us tackle neglect, but we really needed to kind of give that a revise and a refresh and relaunch it, which has happened earlier this year as well. Supporting workers to be confident in challenging decisions, especially around neglect, and also thinking about what neglect means for those our most vulnerable cohorts, such as children who might be electively home educated, children missing education. We know these are things that have developed as real concerns, especially since the pandemic as well. And as I've said, everybody's so busy, the demands seem to grow and grow across all of our jobs. How can we support busy practitioners to know where they can get information and what that means for them, how they can use that in supporting families? And then finally, in the strategic action plan, as I say, we'd already identified quite a lot of the actions. So it sets out what our strategic commitment is and what our leadership approach is to tackling neglect across Sandwell, driving forward that good practice and holding their own agency and each other to account when improvements need to be made. We've got different forums within the partnership. So as I say, we've got the Tackling Neglect subgroup. Our subgroups then report into groups of senior leaders, such as our operations group, our executive forum, highlighted that we needed to strengthen that connectivity between all of those groups. It already existed, but I think it's just building on the foundations that we'd already got and really strengthening that join up. And also being clear to say, what does success look like? We always try to be more outcome focused. What are we hoping to see as a result of all this hard work that's coming out of the CSPR? What are we hoping to see differently as a result of what we've done? So for example, we'd expect to see in the data that we're seeing a reduction in repeat child protection plans for neglect. We might be seeing evidence of appropriate step up and step down between the different tiers of the system as it is at the moment. But the bottom line is that we want to make sure that all of these things that come out are making a difference to children and families. And as I say, reducing the likelihood of something similar happening for other children and families. Okay. I don't know if there's any questions or anything about that in the chat, Jade, but if not,
No,
I'll pass
nothing at the
that to
moment.
yourself. Over to you
No.
then, Jade.
Thanks, Lucy. So yeah, as I said, on the priority lead, leading on neglect for the partnership. So I'm just really going to talk to you about the new approach. And I know some of you might have been at summits and different launches of the Tackling Neglect approach. But yeah, if we go on to the next slide, is it the quiz first? It is. So guys, how many have we got in here? Oh, someone else wants admitting, 1 second. So we've got about 63. So just to kind of get everybody a little bit interactive, which is hard when we've got mics on mute. A quick question, if you can just answer in the chat. How many categories of neglect are there? So if people want to use the chat function, how many different categories of neglect? So we've got 6, a 7, 6, 7, 6, 4, 4, 7 and 6, 9, 10. Lots of people answering, which is great, just to get everybody thinking. 6s, 5s, 10s, 12. So there is 6 categories of neglect. So in Sandwell, we've gone with Jan Hothworth's 6 categories of neglect, that we're really trying to build that consistent understanding across the partnership in those 6 areas. So can anyone name any of the 6 categories, or all of them, if somebody knows them all, for those that put 6? Educational, emotional. Oh, I think we've got someone that's put them all in. Oh, well done. So we've got physical, emotional, educational, nutritional, medical, and lack of supervision. So yeah, so we've really kind of started our approach looking, and everything we've done is around those 6 categories. So GCP2, the graded care profile tool that we use, does anybody want to have a guess, or any of you, what year we launched that in Sandwell? So when do you think we started using GCP2 in Sandwell? Any guesses of what year? Oh, Kate Hill, I mean, you've been at lots of my events, so it's great that you know the year, and S. Hudson. So it was 2019. So yeah, brilliant. Two other questions actually. What percent of SIN, CP and TAF plans do people think we've got open at the moment that's got neglect as a feature? So what percent of plans under the category of neglect? So that's all of our plans in Sandwell. 75, 67, 70%, 80, 70, 60, 80, 75. I know lots of people that are getting involved. Hi to everybody. So it's actually 52%, and it has actually come down at the moment, which is good to see that is coming down. One other question, how many of us across Sandwell are supporting children and families? So that's the whole number of the workforce. How many people do you think there is that work with children and families in Sandwell? So that's across every agency and organisation. Don't know if anyone's got a guess, or if anyone can remember from the summit. 250. So that's across all, yeah, education, youth service, everybody, social care, 500, voluntary sector. Oh, Kathy Ross, 59,000. It's actually around 58,000. Yeah, some people was putting it in. So there's a lot of us. So as we talk through this approach, and I'll share some information, just think about how many of us collectively need to tackle neglect together. Thanks, everybody. If you want to move me on. So just a real snapshot about the journey of tackling neglect. So as Lucy has spoken about, we had those 2 reviews, and senior leads agreed that we needed a new approach in October 23. Then we did lots of Let's Talk Neglect consultation across the workforce. Don't know if any of you attended. So across November and December, and we had lots of different agencies, different roles and professionals there to get their views about what are the barriers to working with neglect, what are their worries, what is good practice, what is going well, and to really understand what the workforce wants as those being frontline on the ground working with families. So then, following on from that feedback, we then went into multi-agency task and finish groups to kind of look at the different elements of our new approach and devise tools, look at what that could look like. And then June 24 to September, we really looked at that new data set, and we did a lot of consultation on practice tools and what they could look like and what practitioners wanted. October 24, we got agreement and endorsement from operations and the executive group of yes, we're happy, that's what the new approach is going to look like. And then we did some consultation with young people as well in the youth service. We launched back at the November summit, so kind of talked about what our new approach is going to look like, what this is going to mean. And then the new approach went live January this year. So already, it flies, doesn't it? We're in 6 months into our new approach. And we continue to work on that new approach. So across March and up to that now, we're still creating resources and things that are adding to our new approach. And we are going to be reviewing our new approach. So that's the Tackling Neglect subgroup. So we've got something booked in to look at where we are, what's working well, get feedback, and look at what else needs to happen. So there's 4 elements of the new approach. So one element is that leadership and culture. So as Lucy spoke about in the review, we talked about and it looked at that strategic ownership and what that means for our leaders, senior leaders of the partnership. So we've got a pledge from the exec team. So the exec team, are committed to really supporting and driving neglect. I'm not going to read them all out, and on our website, and the links will be in the slides at the end, you can look at that full pledge really and what it means. So they've agreed that, practitioners who work directly and indirectly with children will have a good understanding of Sandwell's new approach. So again, that comes from dissemination of information. We've done lots of launches, lots of briefings. We'll go around the partnership, me, Kate, various people talking and launching that. Everybody across the partnership has a member in Tackling Neglect that should be your lead and your champion. If you haven't heard about the new approach or you haven't got a champion, get in touch. So promoting that strong culture and shared responsibilities and responding to those early signs so we know that we need to intervene early. And then around the neglect screening tools, that we will commit and use the tools. I think as we talked about GCP2 being launched in 2019, we didn't really use the tool. We haven't got enough evidence to decide if that tool is the right tool for us in Sandwell. So it's about us all using the new tools in the approach to be able to guide and, really spot those signs of neglect with a family. So the next part was around effective interventions and a skilled workforce. So the effective interventions, we've got now a neglect screening tool. So when we did the neglect consultation, we know we've got GCP2. And people really talked about how it would help just to have a real early indicator, an aid that they could use in practice. So it's if you haven't seen it, again, it's available on our website. It's broken down into the 6 categories with some questions under each one. Really easy, a tick box, yes or no. Again, it's great if you can use it with a family. We encourage that relationship building and doing with the family. However, it could be used as just something you use in the office, a discussion with a colleague, and it not go anywhere, just to have a tick. And at the bottom of that screening tool, there's pathway to kind of talk, right, if you've ticked 3 or more, do this, and recommendations of what you should do now in practice, and just gives you that really early identification. GCP2 we're continuing to use. Now, when we was reviewing the approach, we looked around at what other tools there are to identify and assess neglect. Across the country, there's nothing that had been evidence-based and tested that we could adopt. Majority of local authorities across the country that I have communication with are using GCP2, or if they're not, they've mirrored it. So again, we decided, right, we're going to have 12 months of really promoting the use of GCP2, but also using it collaboratively. So on the domains on the GCP2, we have housing, we have medical, we have, education. It's about that, that multi-agency team working together to really complete GCP2. And again, the training's free if you haven't used it. It's available on our website. And then we've also designed a practice guidance and pathway for professionals. So our neglect strategy, I think, was about 22 pages, and we know practitioners haven't got time to use and read those things. Great if you have, some people love them. And, you know, it is good to go and read. However, we've now got a 3-page practice guidance and a pathway that you can print off our website using supervision, really quick access to support practice for, you know, what you can do when you're faced with families with neglect. We've now just launched last week our new 1-page strategy. Again, if you haven't seen it, it's on our website. Share, print off, disseminate. We know we needed a skilled workforce, so we've done a refresh of the Neglect eLearn. That takes about 40 minutes. It's available on the workforce. I think when I last looked, we'd got just over 3,500 people that have completed that Neglect eLearn. But think about the 58,000 people across the workforce. We're saying that everybody who has any form of contact with children and families should complete that Neglect eLearn. Again, it's available on our website. Promote it, access it. Increased attendance at GCP2 training, and we have been seeing that. It's great. We know people are wanting it. It's getting booked on. We've now recorded a refresher of GCP2. So many people did it pre-COVID, did it and haven't used it. For those that it works for, there's a session that you can jump on, watch to give you a bit of a refresher. If that doesn't suit you and you need to attend the training again, that's absolutely fine. We've done lots of neglect briefings across the workforce. We've also got our Tackling Neglect members to do briefings in their own agency. There's lots of comms going out about neglect. Quite new, we've now started doing podcasts. I can't take credit for that. That is Leanne, our L&D coordinator. So we know how busy we all are, and you know, time out for training can be difficult with our diaries. And podcast is a really good thing that you can just listen to while you're working, on the way back from work, in your car, you know, on a night time, if that's what you like to do, before you go to sleep. So we've got podcasts available on the website, and there will be a podcast on each of the 6 categories, as well as kind of hot topics. So I know we've got health, who have just done cumulative harm. The police and school are doing one. So those are partnership-led practitioners talking about topics and giving you that support and advice, really, to listen into. Again, if you're interested in getting involved or you have an idea for a topic, shout and let us know. We've got Neglect Champions, and we've also got a Neglect email. So that email I have access to. Kate does, who's the chair of Neglect. Any questions, concerns, comments, feedback, please feel free to use it. So safe, loved, cared for babies, children and young people of Sandwell. So the one element of the approach really focuses on what is good enough care. So again, I think when we talked to people and did the Let's Not Talk Neglect, we had some real open discussions about it is difficult to say, yes, that's neglect. We've all got different standards. You know, it can be biased, it can be confusing, you can't always see neglect. And also, you know, we had a couple of comments around, well, it's not as bad as so-and-so's house. And actually, we need to move away from that and have a consistent of understanding. So we've built that in all of the tools that really talks about, you know, the 6 categories and what we expect for our children in Sandwell. And again, that kind of mirrors the GCP2 that looks at that lived experience for that child, babies, and what is acceptable. We've really focused on our vulnerable cohorts, so that conception to reception. So we know how important that period of a child's life is. We know they all are, but they are vulnerable, and also those with additional needs. So now we're just going to play Ivy's voice. So this is, we have changed the name, and this is a Sandwell child that has pulled their thoughts together. So if everyone just wants to take a moment to listen, it's only a couple of minutes.
If you can't hear it, shout out, Jade, but hopefully it'll work.
Yeah, no problem.
I used to think maybe no one sees me, like I was invisible or something, you know, right there but never really there. People always seem so busy, so wrapped up in their own worlds. They walk past me, laughing, talking, living, but somehow I'm not part of it. I try to speak up, but it's like all my words fall before even they reach their ears. And when I look around, all I see are backs turned and eyes that don't meet mine. There are days when I feel like I'm drowning in silence. Even a room full of people, it's like being locked in a place no one can reach. Or worse, a place no one even tries to. The loneliness, it's heavy. Not the kind you can carry out on your shoulders, but the kind that sits inside you where no one sees. But then I think, maybe it's not that people don't care. Maybe they just don't see. Maybe they don't know how much it hurts to be forgotten, to be neglected. A kind of word, a smile. Someone to notice when I'm not okay. Maybe that's all it would take to change things, to make me feel like I belong, to remind me that I'm not invisible after all.
Thanks, Lucy. Yeah, so I think it's really, Lucy spoke about the child deaths, and obviously we've got Ivy's voice. And yeah, go on, Lucy. I was waiting for you to move to the next slide. So I think it's just good just to take a moment, and it is powerful when we listen to children's voices, just to reflect on what you've heard, everything today, and think about what this means for your service and organisation, individually, collectively. Yeah, so I'm just going to give everybody a minute. I think we're all right for time, aren't we, Lucy?
Yeah.
Again, you don't have to put anything in the chat. If you want to put anything in, feel free. Yeah, and I think I'm just reading the comments, and even I've played that numerous times now, and even me, I think we all do relate to it, don't we? And it is sad. And I think the tackling neglect approach, it is about the whole of us and how we contribute, and everybody is going to be different. So yeah, thank you. Luce, do you want to move us on? So just a little bit about what does this mean for managers? And again, managers that are here, or if you're not a manager, think about your manager. So it's about you and your teams knowing about the safe, loved and cared for. Does everybody in everyone's team know? Does your manager know? Have they, spoken about the new approach? Being clear about the practice tools that are available that I mentioned, the screening tool, the pathways. Encourage staff to be curious if neglect is suspected. Using the screening tool GCP2 within supervisions, group supervisions, and promoting that GCP2 is collaboratively done with agencies and services that's involved with the family. So what does it mean for practitioners? So use the neglect screening tool is to help understand if neglect could be a feature within a family. The earlier, the better to work and really support families. Ensure a GCP2 is completed where neglect is a feature, and we are all committed to completing GCP2. So again, recommend that when you're working as a multi-agency team, look at where you can contribute. Identify and support the most vulnerable, and think about how we use the STAR practice model in our support that we're with families. How are we being collaborative and using things in supportive ways? Use the practice guidance. So if you didn't know about it, if you haven't got it, print it off, save it, look at it, be clear about when enough is enough, and when we're not making desired impact. Challenge each other. So, it's about us professionally challenging decisions and voicing our opinions, collaboratively, in being professional. And also, if you're not happy with decisions, using the dispute resolution policy, because actually, if you don't agree, we need to come together and speak and voice our challenges. Become familiar with the practice tools on the website. So we're creating new things all the time to support everybody. Listen to them, give feedback. Is there any ideas things that you think you need or want? And complete the Neglect e-learn. So like I said, everybody across the workforce is part of tackling neglect, and it's all of our approach. And together we need to ensure that babies, children and young people in Sandwell are safe, loved and cared for.